Perfect.
All right.
All right, so I'll start with mine. And let's see. So, relevant problems I felt were feeling crummy for 6 months, loss of interest in doing things she previously enjoyed, not being able to concentrate, feelings of hopelessness, crying all day in bed after calling in. Obviously, thoughts about suicide are insanely important for us to focus on. And then, not bothering to eat most days, her insomnia, and her energy. And then she meets multiple of the DSM 5 criteria for major depressive order disorder. She's been experiencing it for a while, which means it's getting worse. And then obviously with the suicide ideation, patient might need psychiatric help to ensure safety. And obviously suicide risk assessment, possible mental health hold if she's a danger to herself. Lack of eating could mean that she's having some nutritional deficiencies, and if she's not eating, she's probably not drinking that much, so dehydration, possible electrolyte imbalances. Anything to add there? You feel like I covered it probably pretty well?
No, I think you did a great job. I Yeah,
Great.
you did it with full detail too, so I think that's good.
And then relevant data from social history. Loss of romantic relationship is obviously one that's bothering her. Guilt over enlisting, guilt of enlisting over relationship. She's overwhelmed by education planning, increased alcohol use to help with her insomnia, and her grandmother poses a risk for family history for depression and mood disorder. So patient may be exhibiting adjustment issues from military life to current life. Increased use of alcohol definitely shows that she has poor stress management habits and she can develop an alcohol use disorder. Alcohol makes depression worse because it's a depressant, so that's even worse for her. And then depression may run in the family. So, and then her vital signs to me look stable. Everything's within like normal ranges. She has no fever or infection. Blood pressure is normal. No heart problems are evident, and respiratory seems to be normal as well. And then I started this one. I
I
have
agree
more to
with
add,
that.
but so relevant data from her appearance would be
Hmm.
she's disheveled. They said no makeup, but I feel like that's not like a judgment on how people look because some people don't wear makeup. She appears tired.
Yeah.
Just
Yeah.
so I think that that is definitely one of the things that is like good to focus on. Um, and to me, like with her being in
Hmm.
the military, her being disheveled definitely shows that she's like struggling because they're known to like be so specifically dressed in a certain way that like that shows for her. And then wringing hands during an interview, to me that like shows that she's kind of disassociating and trying to just like distract herself during the interview.
Hmm.
Speech is a little slowed and slow to respond to questions.
Yeah.
I think that's in the reading for this chapter that they're like cognitively um like slower when they're feeling depressed. I'm not sure. I have to like elaborate on that one. Appears sad, reports feeling anxious and sad all the time. And then hopelessness. So those are all important. Um, geez, sorry. So she's logical, so that's good. She's making her thoughts make sense. Reports feeling guilt for feeling so bad for no reason and leaving her boyfriend all those years ago. So I don't know if this would like fit in like the grief stages, but I feel like with how long it had been since she left him, like this is unhealthy. Um,
Yeah.
I'm gonna look
Yeah, I
into
was thinking
that.
that too.
Yeah, like super unhealthy, and I don't know if maybe like the stages of grief she hasn't went through, um, or if
No, there was like I think she's like crisis or something.
yeah,
The one crisis where it's like I forgot what it was called, but I think it started with a D.
okay, I'll look into it.
No, I forgot. Yeah.
Find it, you can send it to me later, but I definitely, and maybe she just feels so depressed
Yeah.
that something that she's like kind of clung on to. Um, so we can see
Hmm.
if that goes further, but I feel like that's an
Yeah.
unhealthy part of her thoughts. Um,
Yeah. That is for kind of
yeah,
unhealthy. Like if it was just like weeks, but
right.
it's been years.
Yeah. She keeps having thoughts that she's no use to anyone, so worthlessness, hopelessness, denies delusions and paranoia thoughts when assessed, which is good. And then she has no evidence of psychotic thinking or loss with reality, so um that's good. But I still think she should see the psychiatrist to make sure that she's not like a danger to herself. Um States her perception. States she doesn't feel right,
Yeah.
or no, states she occasionally hears her name at night when attempting to sleep. Is that not like a delusion? Like if she, it says no hallucinations or
I think that's a delusion.
yeah, she knows it's her imagination. So she
I
knows,
think that's a,
yeah, I don't know. She like knows it's not
so
right.
she's aware,
Right.
but she still hears it. I mean, okay, when I was in clinical, there was this patient, he was like occasionally always like having like the normal thoughts, like the normal voices.
Hmm.
And then like the psychiatrist was like, "Well, that's normal, but I don't know.
Okay.
Maybe it could
Look
be,
into
but
that a little bit more too. Because to me that
yeah.
sounds like she's not doing great. Um, but she
But at
knows,
least she's aware.
yeah, she's aware that it's not real, which is important. And then she knows she doesn't feel right, but does not recognize symptoms as part of clinical depression. So I think just education's really important in this to let her know, like, this is okay, this is normal, but there is depression, something that needs to be treated. This isn't like how normal, I hate that word, but how normal people act. So I think it's important for her to be told that. Um, she's alert and oriented times three, but it doesn't say what she's not oriented to. So I don't know. And then, like I said earlier, difficulty concentrating, attention span um, is short. She's withdrawing from her friends and she thinks about suicide, but would never act on it because she would never want to hurt her parents. But I think the fact that she thinks about it is like good enough to make sure that we're doing what we can for her safety. She denies homicide or thoughts of self harm, but I feel like if she's thinking about suicide, that's enough for us to intervene. So, yeah.
Yeah.
All right.
Overall, I think you did a great job.
Thanks.
I yeah, it's just those little small stuff, but
Yeah,
other than that, I think it was
I
great.
just haven't gotten around to it this week. We all know what that's like.
Yeah, no, you're fine. I know. It's like a really busy week.
All right. So, who did current assessment? Is that the
I was doing part two, majority of part two,
Oh,
so
maybe that's still mine. Maybe I did start.
Oh, I, no, I did a physical
Oh, okay.
assessment. I did, yeah. So for her, physical assessment data, for her relevant data. I put she appears tired and anxious for her general appearance. And this can be a symptom of chronic depression. Can you hear me in the first place?
Yes, you
Yeah,
poor
I mean, if you want us to kind of talk about what you put down so far, we can do that. Because yeah, yeah, it's
you poor
okay.
thing.
Amanda and I can talk about what Rachel had put down. Yeah.
Yeah.
Uh, uh,
Sorry.
this year, because she didn't have any
Yeah.
physical. Sorry, I need to tell my son to keep quiet. Because when you look at her physical appearance, she didn't have like much in there. So I only put like two. So like the first one that is like really, really like some anxious, and which I put there like signs of like chronic depression, because they usually like feel tired and don't want to do anything. And if they're anxious because they think like someone is trying to do something to them, just like how she's hearing like voices in her head. She's like scared to move on. And no abnormal cardiac, respiratory, or GI findings. So it confirmed non-physiology, geology or symptoms. That's the only thing I put there because her physical appearance looked good. Good. The only thing I was wondering about is like in her mental status, then her neuro was alert and oriented times three, right? But right here is alert and oriented times four. I was like, how does it happen? But like, I don't know. So that's the only thing I was like kind of worried about. So her labs, her labs appears, the all appears like normal or within normal limit. Are within normal limit, so they rule out any electrolyte or metabolic cause of the symptoms. Her CBC counts are all within normal range, so there's no evidence of infection or anemia in hers. Her thyroid is five elevated, so it indicates possible hypothyroidism, which can mimic or worsen depression. One of the major symptoms of hypothyroidism is depression. It comes with taking the medication. Because I know someone who has it, the person didn't have depression, but when they started taking the medication, they started getting depression. So it's side effect of the depression. So maybe yeah, depression too can be because she's taking thyroid medication or something like that. Or maybe she had the depression, but the thyroid medication has made it like more severe. Yeah.
Yeah, because the hyperthyroidism can make it's like a imbalance of hormones too, so that definitely adds to it. So, good job.
Yeah. Yeah, Rachel, I think you did a great job on here too.
You poor thing.
Okay.
That sounds so
Moving
terrible.
on. Yeah, I'm so sorry, girl. Yeah. We'll just go through this really quick because I know you're not feeling well. So, going to part two of putting it all together. I said the major problem was major depressive disorder with suicidal thoughts. And the path of it is obviously I put that there is a change that can affect their daily moods, like happiness, loss of interest in daily activities, just those kind of things. And then I digged a little deeper, and then I found that it was a chemical imbalance in their brain, which involves their neurotransmitters such as their serotonin, norepinephrine, and dopamine. And when there is a chemical imbalance with these neurotransmitter, it can affect the patient's mood, sleep, appetite, and concentration, which can affect how they feel, think, and act. If there's anything you guys think that I should add to that, please let me know. Moving on to two with the medical management. The patient was admitted under voluntary admission, and I thought that this was um, I think this, as the rationale, it kind of just proves that she wants to get the help and that she's like, it just kind of builds that trust with her and us as the nurses when we're looking at this. So it just creates a safer environment to create that therapeutic relationship. And the outcome is patient will be in a safe environment, which allows her to be safe. She will be participating in treatment and will demonstrate improvement. Will initiate in, I don't ever know how to pronounce, but therapy. She will be in therapy, which will help improve her social interactions, safety, and create coping mechanisms to help her. This will help with normalizing routines and help decrease isolation. And again, the outcome is patient is interacting with peers and staff appropriately and will have improved moods and coping skills. Moving down to making sure that there are safety measures according to unit protocol. This is so that the patient is on consistent monitoring because again, I think that she does deny it, but it's something that we should still be cautious of. So this will help prevent self-harm and recognize any suicidal behaviors. And patient will be free, self-harm free, and there will be no injuries to the patient. Vital signs upon admission, then daily. This will help us ensure that her medication is not affecting her, how would you say it? Physically? Like, no, that's not the word I'm trying to find. It will just shows that her medications are not causing an effect to her. And it will also just help us keep track of if there's any important findings of any adverse effects. And vital signs will be in normal ranges, and there will be no adverse effects from medication. Regular diet and monitoring intake. When it, yeah, it is good that has a regular appetite and regular diet because poor nutrition can also cause increase in um, behavior problems. Would you say that? No. It would just like cause some behavioral issues that could potentially lead to self-harm. So we'll make sure that she has a consistent weight and she's not feeling fatigue, and we'll monitor the intake to ensure adequate nutrition. And I said that this one was kind of like, I was like, for the expected outcome, I just put that patient will at least eat three-fourths of their meal and have a stable weight with improving energy. Moving down to their medications. So their first medication, I'm not even going to try. This medication helps increase serotonin levels in the brain, which can help improve energy, appetite, and will be able to concentrate as there is a decrease in depressive symptoms. Patient will have reported improved mood, energy, and sleep with a decreased thought of suicide. And then their second medication. This is an antidepressant with effects of sedatives, which will help with their insomnia and cause that is caused due to depression, allowing rest without high risk, and patient will have improved energy after taking this medication. Yeah, they will be good during the daytime. And then their last medication, this is a short-term relief for acute anxiety or agitation by enhancing the GABA activity in the brain. Patient will have a decreased agitation and anxiety. Patient will stay calm and be cooperative.
Perfect. And then did you do the rest? Or who did those?
But
I did not
I
do
did I
or
did three.
Okay.
The cooperative care. The first one, the nursing practice is like ensure she's stable, her safety, stabilize mood, and promote coping. Right. So the first one, at the end of the every shift, we have to like assess suicidal risk. Um, so we can ensure in case you have one, you can ensure early intervention and patients will remain safe. This will enable the build trust and communication. Once they feel comfortable with you, they are able to like tell you like things they don't want to tell anybody, right? For you to like really know what the problem is. Patient will express their feeling openly without like having any doubt of you selling them out or anything like that. We should also encourage the patient to participate in group activities. This will kind of like move their mind off them trying to harm themselves, and also like improve like social interactions. Uh, when they are depressed, they like to be alone. So like having them in group activity will just a second, just a second, please, just a second.
yeah, you're
We can keep talking about it too. Her poor little voice. Um, so she also put monitor medication adherence and side effects, prevents
yeah,
relapse or serotonin syndrome, and compliance and symptom reduction is the expected outcome. And I agree with those. Um,
I agree with those two.
we'll add this stuff in. We just kept
So,
going, Rachel, because your poor voice.
uh,
Or five. Oh,
We're gonna
yeah,
do
no, it's okay. I know that you're struggling right now, so it's okay.
the psychosocial one, Rachel.
yeah, I'm going to do that one.
Okay, no problem. Um, yeah, I mean we could talk about it too. Gosh.
Yeah, we just
Yeah, so like caring and comfort,
yeah, I mean, we could talk a
show
little
them
bit
that
about it
we're
and what
we can show that they're like we're here for them.
yeah, so we can like greet them. Mm-hmm. Yeah, and like just using like active listening and open-ended questions and just validate her emotions and just have consistent presence with her.
Yeah, just letting her know that she's not alone.
So,
And then emotional
uh,
support, that's like through therapy, through um like group activities so that she sees that like she's not the only one struggling with this. Um, involving
Spiritual,
her family.
yeah, like um, I think emotional support, because I put that in the teaching too, is that, involving her family and friends into her care will help with um improving her behavior, not behavior, oh my gosh, her emotions.
Hmm. Just knowing that she has other people there for her is huge.
Yeah. And
Spiritual
then
care
so,
is. she is religious, we could involve like the chaplain to come talk to her
Hmm.
while we're
Hmm.
in like
Like
the care
just
setting.
yeah, and like give her quiet space for reflection if she needs it.
Hmm. Cultural care, if
Oh.
necessary. Obviously, we would help make sure that her care is respectful to her culture if necessary, which
And
I don't
again,
think
just
I thought
to
anything about that, about her having like cultural differences earlier, but
and just be appropriate when you are talking to them about culture if she does have culture beliefs. Yeah. Overall, I think we all agree about I mean, all of the ideas that we came up with. So it's
yep.
pretty good.
And then who did five?
I did. So we can look at it. So what educational discharge priorities that need to be addressed to promote health and wellness for the patient and or family. So I put, obviously, we need to teach her about the medication, the side effects, when to take it, and that she shouldn't stop it just abruptly, or else it's going to cause, um, the one that starts with an S. I don't know how to say it. I'm not even gonna try. It can cause serotonin syndrome, so we want her to be aware of that. So as her other two medications, which again, we need to tell her that it's gonna cause drowsiness, so she should be taking it at bedtime, and then she shouldn't be just going anywhere when she is t on that medication. And then also for her third medication, it's a short-term medication, so it's just to help with her dependence. Help
Perfect.
prevent. Yes.
Yep.
And then moving on to safety precautions. Again, we just want to make sure she's in a safe environment. We just want to make sure that she's not having any suicidal thoughts, such as hopelessness, withdrawal, or just giving away belongings. And then we want to develop a safety plan, including the friends and family, and just have a safe environment with no harmful items around her. And then
Perfect.
moving on to some lifestyle changes, we can tell her that it is important to have a healthy diet, stay balanced, and just having like a good physical light activity that she should be doing every single day, such as walking or just practicing yoga. Those are just some examples, but she can also, there's so many other things out there. It's also great to have proper sleep. I think that with all this medication and all her feelings, I'm thinking that, and all her past history of like everything that's happened to her, it's good for her to have improved sleep, which it can improve her energy and have her on things that can help her is just having her on a sleep routine and then just having no screens before bedtime, which can improve her sleep quality so she can do things such as journaling before bed to increase relaxation.
Perfect.
And then we just move on to just kind of like the last part of um, psychotherapy, supporting systems, and follow-up care. It is important for her to attend the scheduled therapy sessions to help decrease triggers and create new coping skills for her. It is also really important to involve her friends and family to educate them about what depression is, what it can look like, and like just like it can affect her daily life, or sometimes they're like present, sometimes it's not. So it's good to keep them inside the loop of understanding all this, and it can help also improve the care for her. Along with this, it is important to encourage joining support groups for depression. And it's just good that she knows that she's not the only one that's going through this, and she can just be with other people that's going through the same thing. And um, great to give her some brochures and some other resources that that she can look into because maybe support groups aren't her thing and she wants to do more one-on-one sessions. It's important just to give her as many options as they can, just so that she feels involved in her care also and that she has, you know, an opinion in her care. And it's also important for her stay to stay up with her follow-up appointments because, you know, again, we want her to stay on a routine, to have her like, know that this is okay and like have her just go to her therapy sessions and, go to her primary care providers. And this is just to also help monitor any early signs of relapse.
Yeah,
And
I
that is
think that's
it.
great.
Yeah.
The only thing I would add to safety precaution and crisis interventions is maybe add like the suicide hotline number
Oh
or like
yeah.
in there about like different resources that she has if she does start feeling like stronger suicide um thoughts so that she can contact someone and talk to them if they need it. That one's I think it's 988. That one's like a big one for
Yeah.
people to be able to call and talk to someone who can
I
try to
did
talk them off the ledge.
not know that. So yes, I
Perfect.
will add that in. And then, yeah, and then as for our resources, just make sure that we all add in the resources that we use
Yeah, we will.
and try to make it alphabetical order. I
Yeah.
don't know. I know that some teachers take it off, so I'm not too aware.
Yeah.
But yeah, so far we did really good, guys. Yeah, thank you guys for honestly just doing your part.
Sounds good. I want to submit this tomorrow night, probably about 8-ish. So if we could all just make sure that everything is in there,
Hmm.
um, and like all of the resources are on there or references are in there, and I'll submit the video and the case study. So just make
Okay.
sure it's done
So much
tomorrow.
for doing that. I know that you have a busy schedule too.
Oh, yeah, you're fine. So
Uh,
just make sure it's done by 8 p.m. tomorrow. Like
And
our
if you guys,
time, if possible. Sorry.
no, no, you guys are fine. For me, it's 9, so it's
Okay,
later.
perfect.
So you guys are fine. Yeah, and if you guys do need any help, feel free to contact in our group chat. And yeah,
Perfect. Well, thanks, guys.
thank you guys so much.